Okay, so we can work with individuals. What about working with families? Right, another dimension. The strongest oak of the forest is not one that's protected from the storm and hidden from the sun. It's one that stands in the open, where it's compelled to struggle for its existence against the winds and rains. Families aren't, always doing well, right? And families aren't always struggling. And families can go through stress and crisis and thrive at the same time. Right? It's a developing organism, so to speak, of all of its members working together. So maybe we don't have to work on the individual. Families grow and families evolve and individuals within those families evolve. Maybe we can support the whole family unit and find change. We know that the health of a family interacts with the health of the individuals within that family. We know that supporting caregivers before mental health problems emerge in a loved one, as well as afterwards, is an important part of clinical service delivery. We know that there are a number of parent factors that can help, whether it's equipping parents with, or parents who might come with psychological resources, feeling empowered, feeling like they can accept problems for what they are, feeling that they're able to focus at the right time in a problem-focused way on dealing with problems. We know that's actually related to success in care. We know that it's important to have family respite. That there is the right kind of social support at the right time. Not everybody wants that informal social support knocking on their door all the time, saying, I'm here for you, I'm here for you, I'm here for you, I'm here for you. Sometimes I got this, or sometimes I want that privacy. But there is the importance of having that availability at the right time, informally as well as formally. We know that having positive experiences with engaging with systems of care, broadly speaking, whether it's accessing the family physician, using the school system and the school-based supports in the right way, or specialized mental health care, right? That the more positive those experiences are, the less people experience barriers to asking for help and knowing where to find help in the right way. These are things beyond the individual. We know that parent psychopathology, parent mental health difficulties, is associated with child mental health difficulties. More specifically, links have been made with mother's experience of depression, with parent stress, with punitive parenting strategies, with negative experiences of expressed emotion. And those are things like over-criticism or a lack of warmth. Now, this is not to say that these are the things that cause mental health problems in children and youth. Far from it. We're just talking about an association here between the two. Because I'm asking you to consider that maybe the person with ASD is not the only person we should consider if these other factors are correlated. There were two studies, though, I should remark, by Vaso Titika from the UK that I do want to highlight that actually started to try to pull apart what comes first and what comes second, right? Like, if these are things we know they're associated, but typically we just say it's probably bidirectional. So they kind of did this kind of analysis where they tried to delineate, well, almost what comes first. They're not really there yet, but what they did is they had parents and youth of children who are 3 years of age and their parents, and then they followed up with those youth at different time points over time. So what they found is that early behavior problems at 3 years of age didn't lead to later problems in at least mother's well-being, kind of at 5 years of age. Right, which is interesting, but that mother's kind of psychological distress and physical health problems and lower life satisfaction at those earlier kind of ages predicted greater difficulties in the children later. So does it mean that those things are causing those difficulties? No, it still doesn't mean that. But what it does mean is that if you're working with families, or if you're considering families, supporting families of young children with autism, if you see families in distress, if you see mothers with high levels of stress, that if you care about how that child is going to be later on, maybe it's one of those factors we should consider as helping those parents at that earlier time point. We published a study, a correlational study a while ago that kind of looked at parent involvement a little bit as parents as a resilience factor, as a protective factor to kids with autism who are experiencing bullying. So what we had kind of three groups of parents, okay? we had three groups of kind of families. We had parents who reported low levels of positive affect or low levels of warmth, so high levels of stress and high levels of distress around parenting. We had parents who had kind of relatively moderate, and they're just low relative to the other groups. A group with relatively moderate levels of kind of experiences of positive and negative feelings about parenting. And then we had parents who reported very high levels of positive experiences of parenting and very low levels of negative experiences in their parenting. Not being negative to their child, but just about what it feels like to parent and their emotional experiences of parenting. And what we looked at over time, the kind of bottom line that you see is that kids varied in terms of if they were bullied or how frequently they experienced bullying, right? And for all three groups, all three lines, you see that it goes up. That anxiety, symptoms of anxiety go up if you experience more bullying. Right? It doesn't matter your parent situation in that sense. But what we also found is that parents in the yellow bar, if you will, with the lowest level of positive affect, so the lowest level of parent warmth, for example, those kids had a higher curve, so to speak. So there was a different trajectory almost, if you will, that there was an interaction that happened between the level of negativity or level of warmth that the parents were reporting on, and the anxiety kind of interacted with the degree of bullying. So bullying on its own is something that was associated with higher levels of anxiety, but that parent-reported kind of positivity interacted or somewhat buffered or moderated that association. So the association wasn't as strong in situations where parents had lots of positive affect, and it was much stronger, the association between bullying and anxiety, which was much stronger in situations where there was low levels of positive affect. Okay. The last thing I'm going to say about kind of this piece is that families evolve over time. So you might be working or considering a family right now who's balanced in some ways, that the level of demands that they have and the resources that they can bring to address those demands are balanced. And they're able to pull from that, and the meaning they place on that is healthy. But then maybe an imbalance emerges. Maybe something happens. There's a loss of a loved one, somebody loses a job, a new behavior pops up, there's a transition from one program to another or a loss of program, right? And there's all of a sudden an imbalance where the demands outweigh the resources that we can apply. That happens all the time. Families are resilient. They accommodate that. They adjust. But sometimes they have difficulty adjusting. And when they have difficulty adjusting, families can often enter into a period of crisis. Many families helping people with autism experience crisis at some point. And part of our job there is not necessarily, if we're seeing that there's not enough resources, it's not necessarily just about getting more resources in. That could be part of it, but it could be about helping families cope with the experience of crisis, with this destabilizing family experience, so that they can find balance for themselves again. There's a person or people with autism in that family as part of that experience. They're just not the target anymore. In terms of the evidence base, we know we can intervene with families. At least we know we can intervene, I should say, with parents. I don't know of many intervention trials that actually have done family therapy, but we know in terms of supporting parents of people with autism, we know things like acceptance and commitment therapy seems promising. There's an emerging literature around mindful parenting, where we help parents be mindful about their experience of parenting and stay able to accept the positive and negative experiences of being a parent. We know that parents can help other parents do this kind of work. We don't even need necessarily a clinician other than a properly trained parent of a person with autism to provide these kinds of interventions. So there's a great study by Elizabeth Dykins from Vanderbilt University where she had parents, she paid parents to be the therapists and get the mindfulness training and get the training in these two interventions, whether it was mindfulness-based stress reduction or in this positive empowerment supports. And then the parents ran the groups of parents with kids with developmental disabilities, including autism. And both of these interventions showed change over time. Both of them seemed to be helpful, both positively oriented, and the mindfulness one had some slightly faster change than the other ones. But it's just another interesting way. We might not even need clinicians. I'm kind of talking myself out of a job. And we know that parent training can be done through kind of work even at very young ages, through PRT and other kind of behavioral approaches, that parents can be coached, parents can be helped to be the ones to deliver. Even in mindfulness-based therapy, parents can be the ones to deliver the actual work to their children. So whether it's helping by focusing on parent support and helping a parent themselves, or helping the parent help their child, both have an evidence base. We've tried to run concurrent mindfulness groups at York, where we had parents and teens or young adults on the spectrum come, and the parents go into one room together, and the teens and young adults go into another, and both would do kind of concurrent mindfulness practice. What's really cool is that what we did is we focus on youth kind of awareness, self-control, distress tolerance, and parents. The topics are things like impact of reactivity, or attending to their youth in a non-judgmental way, or accepting of youth and their own feelings about being a parent, right? Things that, if you're a parent in the room, this is not exclusive at all to autism, but there's something very special about having families with a shared common experience going through this together. There's this kind of common factor kind of piece that's added. And they really get a lot out of it. This is what I was mentioning before about challenges with clinical utility. They're supposed to practice for 10 minutes a night or 20 minutes a night, and we'd come back and say, oh, how did it go this last week? Oh, I was too busy this week. Did you like it? I love what we do here. This is the only time in my week, it's the only time in my week where I can de-stress. I know my child is taken care, I know my teen is taken care of, right? It's the only chance that I can look somebody else, I feel I'm not judged, I feel like I can just be honest with myself and with other people, with the other people in the room here. I just love it. Do you want to maybe think about doing it, outside? Maybe you guys want to set up oh no, I'm just too busy, or I just can't, or I was exhausted, or you know what, I don't want to, I only want to do it once a week, right? It's like my yoga, I just want to do it once. Right? Like so understanding the interplay there, I think, is very important, okay? But parents do get a lot out of it, and many parents are willing to come in and be a part of this if they know that their teen or young adult is getting something too. Many parents would say, no, don't focus on me, help my child. Right? That's really important. And we try to say, it's not just about your child. When you're in an airplane and the mask kind of pops down, it says to put the mask on yourself first for a reason. You're an important part of this care package.